All right, I'm going to do my PO medications. The first thing I'm going to do is I'm going to verify my doctor's orders with my MAR. I'm going to check for allergies, and I'm going to perform hand hygiene. I'm going to state the 6 rights of medication: right patient, right medication, right dose, right route, right frequency, and right documentation. Now I'm ready to gather my supplies. I'm going to get my MAR, my napkin, my spoon, my applesauce, my water cup, my oral medication syringe, my graduated medicine cup, my souffle cup, my clean cutter, and my clean crusher. All right, now I'm going to go to the medication drawer. I'm going to verify my medication to the MAR. I'm going to, if it's unit dose pack, put it on the right time slot and have my instructor verify. If it's not unit dose, I'm going to pour it into the correct cup. So for pills, it would be the souffle cup. For liquid, it would be the graduated medicine cup. I'm going to do my 3 label checks when I pull it from the drawer, when I pour my dosage, and when I put it back. Now I am going to do my, make sure that I don't have to have any dosage calculations. So my scenario states my patient complains of a cough, and my order is for guaifenesin 150 milligrams by mouth as needed for cough. All right, I'm going to perform my calculations. My order is for 150 milligrams. It comes 100 milligrams per 5 milliliters, and that's going to put me at administering 7.5 milliliters. Here is my calculation. All right, now I'm ready to pour out my medication. So I'm going to check my label and make sure it's not soiled. If it is, I'm going to send it back to the pharmacy. I'm going to take the top off and put it cap up. I'm going to place the label of the medication in the palm of my dominant hand. I'm going to pour the medication without touching the rim of the bottle to the cup or the cup to the rim. I'm going to either do it at eye level or hold it up. I'm going to pour a 7.5 mil to the lower level of the meniscus. There's my medication. I'm going to put the top back on my medication. Now, if my scenario stated that I needed to crush a pill, I would open my medicine bottle, tap the correct amount of medication into the top. If I got too many, put it back and get the correct amount. Put the medication in the souffle cup, put the top back on my pills, put the souffle cup with the medication into the clean pill crusher, place another souffle cup on top, crush until it's a powder-like form, take it out, get my medication and set it to the side. I'm going to get a spoon of applesauce and put it in my graduated medicine cup, pour the crushed medication on it and mix it up, and then it's ready for your patient. Or if I was doing a cut tablet, it would be, if I was having to cut to get like a half a dosage or something, I would get the correct amount of medication into my souffle cup, put it into my cutter, which would be clean, make sure it is not enteric-coated or time-released, and make sure it's a scored tablet. I'm going to put it in all the way in the corner and make sure that the scored line is down the middle. I'm going to cut it, put the correct dosage of medication into the souffle cup, and dispose of any extra medication that we're not using that was cut according to facility policy, as well as clean the cutter or crusher according to facility policy. Now I'm ready to gather my stuff to go to my patient's room. I'm going to check for my high alert drugs. I've got my anticoagulants, my antihypertensives, my insulin, and my antiarrhythmics. I'm going to make sure my medication is not digitalis or Lanoxin. If it is, I'm going to hold it until I check apical pulse. My apical pulse is below 60. I'm going to hold the medication and notify my physician. If it is a high alert medication, I'm going to have another nurse verify my dosage calculations and document the verification. Now my supplies to go to my patient's room for this guaifenesin, it's going to be my medication, my MAR, my 8 ounces of water. Go to my patient's room. I'm going to perform hand hygiene, don gloves. I am going to get the patient to verify their name and date of birth, and I'm going to check their armband. I'm going to do my 3 checks. Make sure my patient can swallow. Make sure my patient is not NPO for any labs or procedures, and verify allergies. going to put my patient in a high Fowler's position. I'm going to administer the patient the medication with 8 ounces of fluids. And then I'm going to perform hand hygiene and exit the patient's room after I've taken my gloves off. I am going to document, and I am going to initial the MAR. After 30 minutes, I'm going to go back and check and make sure that the PRN medication is doing the right things for the patient. If not, I'm going to document that, and now I'm done.